y'all. This is our take. This is Mark the moderator.
Maybe the process 1414.
All right, Abe. So I really want to have a conversation, a social conversation, and let's have a conversation about what we're seeing right now. Of course, this is year 2 of the pandemic, coronavirus, and I know how you have feelings about vaccines there and everything. But I want to have a conversation about where things are right now as we currently sit here in August 2021. We have a bunch of Delta virus cases that have ramped up. Certain states right now is at the brink of really having to shut down the actual health system because hospitals is being overwhelmed by cases. Where do you sit at with everything as you see in your scope? Not debating if taking the vaccine is wrong, not taking is wrong, but where do you see your overall take on the state of where we are as a country with everything that's going on?
Listen, man, I'm being real with you. Like, it seems like things have quote unquote loosened up a little bit, and I use that very carefully. But I was talking to somebody the other day, and the reality is that the more we loosen things up, the more we say, all right, everybody's got to go back, and you got to, whether you're wearing a mask or not, the more people you put together, man, the more this is going to spread. You know what I'm saying? No matter whether you vaxxed or unvaxxed, the more it's going to spread. You put people together, it's going to spread. I think it's scary sending your kid to school. I was reading an article about an area in Florida where, you got hundreds of staff members and students that have been exposed to it that are now quarantined. I myself got to go back to work, 3 days out of the week or whatever the case is. I'm fortunate because I don't have to interact with people on a face-to-face basis,
right.
So I'm fortunate for that. But my other colleagues may have to do that. My other colleagues may have to see students, whatever the case is. So I can't even say I'm cautiously optimistic. I'm just cautious because I can see, real rap, I can see in October we shutting it down. If you watch the news, New Zealand, right? New Zealand hasn't had a COVID case since February.
Wow.
They had one case, Mark. They shut the country down, dude. Shut it down. They were like, we're not playing this. But what I'm saying? So I'm not saying that we're going to do the same.
No. But we don't move like that as a country because privilege, rights, and freedoms is always going to step in the way of what we need to do versus what we're going to do.
Right.
Two different things. Because
people feel like they cannot survive without certain things. You know what I'm saying? And we take that for granted all the time. The joke of the day is, I haven't been at work for a consistent amount of time. So every piece of paper in my office gets thrown out. I don't need paper no more, G. Like, if I could deal without 1 year and a half, you know what I'm saying? I could deal without it now. So but it's that privilege where you start thinking about, I need to go to the mall. I need to be able to do this. I work in a store, people doing whatever they want, gallivanting whatever they want, meeting the crowds, the way they want. I feel like we still just really need to be cautious. I would tell everybody that. You know what I mean? Just be cautious and move cautiously and still, have your head on the swivel. Don't be in too many crowded places and just, pray. You know what I mean? Watch what you're doing. Real rap. Like,
no, listen, you know how I feel. But let me add something to this because over the past couple of days, I've been looking at a couple things. And I think the mixed messaging, I think the country messed up on the outset. This wasn't handled properly. And from that, the trickle-down effect has really hit us. Because of, let's just look at the reality, and I want to sit in the reality of it. You still have people who have been vaccinated spreading the actual virus itself. Right. The problem is the vaccine does not stop you from getting the actual virus itself. Right. The other problem is that those who haven't taken the vaccine can get it and die. The difference is if I taken the vaccine and I get the virus, I won't die from it. But I could spread it to somebody who hasn't taken the vaccine and they can die from it. That's so much of a mixed message. the country says, okay, we came out with a mask mandate last year where you had to wear a mask, but we won't come out with a mask. I mean, we won't come out with a vaccine mandate where everybody got to take the vaccine. Right. Because you have liberties, you have privilege, you have rights. So now you have the freedoms that you don't have to take it. We want you to take it. Right. We're going to push you to take it. We're going to try and give you an incentives to take it, but you don't have to. So without a vaccine mandate, at the end of the day, the number of deaths are still going to happen. The number of deaths are not going to lower because of those that don't have to take the vaccine is still exposed to being able to die from it. All of this is real convoluted in the grand scheme. And that's why you have us against them and them against us, because of we all sit in the same boat. I think. Yeah. I think had they been able to come out with a vaccine that would have said, if you take this vaccine, you can't get the virus, period, things would be different.
I mean, obviously that's really, sort of not the case. You know what I'm saying? And I think I think the country, what's interesting is we pitted ourselves against each other. We've created a civil war of the vaxxed and the unvaxxed, right? And, my whole theory is like, yo, listen, man, whatever you believe, do your homework. That's all I've said. You know what I'm saying?
I don't even argue about it no more.
I respect people who decide that that's not what they want to do. You know what I'm saying? Like, you have the freedom of choice.
Hold on. When you say that, I just want to please add some context to it because of this. Your freedom of choice does not give you the freedom to walk around untested, unmasked, unsocial distancing, and you're not washing your hands.
Your freedom does not allow you and should not give you the right to be irresponsible.
There you go. Now add that to what your statement is, and I'm with you.
So I respect people that decide that that's not what they want to do, but just
still be responsible
and protect others. That's my whole thing. You know what I mean?
That's where I sit at.
My biggest issue is, forget about the vaccine, unvaccinated. My biggest issue is the people that feel like this thing is not real.
Right.
Like,
like, conspiracy theorists.
We gotta stop that. This is real. This is a reality. Right. And I think what we need to do is, instead of saying, all right, you vaccinated, I'm not vaccinated, you're crazy because you took it, or you're crazy because not. Yo, let's just say, all right, this is what I believe, but let's try to protect each other in the process. That's my whole thing. Right. Let's try to protect each other in the process. And let's try to, and the shame is, these kids can't get vaccinated. You know what I'm saying?
Another mixed message.
Our kids?
Another mixed message. Again, it comes back to it's all convoluted because you can't take a kid that's under the age of 12 and get them vaccinated. So it's like, hold on, wait a minute, man. It's so many variables to this whole situation. And I'm not saying right and wrong. I am like you. I've gotten out of the vax debating. I'm not doing that. If we're all responsible, even if you're taking the vaccine, you got to wear a mask.
Right.
Because you can still get it. It's not like you 100%. Can't get it, but yes, you won't die from it. You got a little more freedom. But at the end of the day, you still have to worry about passing to someone who can 100%. Get it and can die from it. You 100%. Still don't change that aspect. But now let me tell you the other mixed message, man. You go to places and it says if you've had the vaccine, you don't have to wear a mask.
It's optional. As they say, it's what?
Sitting here like, yo, it's like bizarro world, man. Like, hold on, wait a minute. Do y'all really understand? Because you've gotten the vaccine doesn't give you the freedom to walk around maskless.
Well, that is a part of the privilege, because the idea, and the CDC messed that up to some degree, because there was this idea, you get vaccinated, you ain't gonna have to wear a mask. You know what I'm saying? And that was the science behind that. Because
they took the science of the protocol of what we know in the past. If you get the vaccine, you won't get the virus. That's not the case. And they're following those protocols as if you will not get the virus.
Right. And the unfortunate piece is, it's really, we're in a situation where it's like, yo, people are just on this idea where I ain't gonna worry about it until it affects me.
But those people, which you see the videos laying up in hospitals, or family members done said that they've died from it because they felt like that and waited till it got to the brink, and all of a sudden, oh, I realized I should have took the vaccine now.
Yeah. Mm-hmm.
But now let me go. But Abe, let me go a little step further with this. In the allotted time which we have left, I want to say this, and I want to speak to the audience. I'm not going to speak on what you should do or shouldn't do. I just want you to think about something. Right now, there's hospitals that's being overwhelmed by cases of the coronavirus from the Delta variant. These are facts. These are not fiction. These are facts. At the same token, if a hospital has run out of beds in an ICU unit, and one of your loved ones has something else that they need to have a hospital bed to get medical care for, do you know they're not going to allow them in that hospital? Because those that have not relied on saying, I'm going to take the vaccine to keep me out of the hospital, is now taking up all the beds for those who are having heart attacks, strokes, diabetes, different ailments, doesn't have room for them to be seen because hospitals are being overwhelmed. The one thing I'll say about the vaccine is keeps you out of the hospital, while those who don't believe in the vaccines is running to the hospitals.
Well, I'm gonna say this. I'm gonna give you a little pushback on that.
Go ahead.
Only because I know that there are situations where the vax are actually still in hospitals. You can be hospitalized. Even your likelihood of passing from it is marginally less than someone that's unvaxxed. So there are vaxxed people in the hospitals
that
right now
with severe symptoms.
Yes, they are.
See, okay, all right, then I stand correct, because I haven't heard that.
I'm telling you that all based off of people I know that work in the hospitals that have shared those stories with me.
Okay, I haven't heard of patients with the vaccine that has had major symptoms behind getting. Okay, 100%. I haven't heard that. Then that's news there to me. That's
now I can't speak to the numbers and how many.
Okay.
I don't want to speculate.
No, I got you.
That is the case. They are more likely though to make it out of that situation than those that are not vaxxed.
Okay.
Absolutely.
Okay. But that's what I'm saying.
To some degree, yes, you're right.
No. Listen, because of there's other ailments that people will encounter. And if a hospital is filled with COVID patients, then that means that your loved one, when the ambulance come for them, they're not taking them to the closest hospital because that hospital's overwhelmed. They got to go elsewhere for care. And who knows how far that is, because they can't get immediate care based upon the fact, because my only thing is this, and I don't want to be harsh about it, but for those who sat in the seat of saying, I'm not taking the vaccine for X, Y, and Z reason, then stay home. If you start getting critically ill and critically sick, then stay home. Don't run to the hospital now because you're taking up space for those that need care. You chose not to help this situation by not taking the vaccine, knowing that it lowers the chances of putting you in the hospital. Now you want to run to the hospital when there's somebody having the heart attack, having a stroke, and they can't go. And that to me is where the problem lies in, because the overwhelming cases is really overrunning these hospitals, and also the staff. The staff is being overwhelmed, and that's just making it critically hard on everybody, man. That's why I say my only push is think about what you're doing and the choices you're making and the impact of it.
Right. Yo, listen, man, like I said, pray. You know what I'm saying? Listen, and shout out to everybody. A lot of people be like, yo, I'm big on your immune system, all of that, and da-da-da-da. And yo, listen, I agree with that. I ain't trying to say don't eat healthy and don't take care of your immune system. But just understand just COVID in itself attacks your immune system. You know what I'm saying? That's what it does.
And it doesn't attack the weak immune system only. It attacks the immune system.
So people, and that's why I said, just do your homework, man. Like whatever people decide, do your homework and stay safe, man. That's all I can say to my people out there.
because the asymptomatic is basically can pass it to somebody. And let's be honest, we got people around us that aren't healthy.
Right.
You might
100%.
be healthy, you might get it with a strong immune system, and you have a cold, but you go around your 80-year-old grandmother, and she has a weakened system, and then she gets it and pass away. So now, I mean, again, these are things which you have to look at, because once again, it's not only about you, it's about caring about others and making sure that you think about the others around you. It's not just you. And too many times I keep hearing about the me, the I, and not the we and the us. So I wanted to have this conversation, Avery. I appreciate you sharing and having this conversation. Everybody out there, you have a choice to make. We don't tell you what choice to make, but just do the homework, just like Avery said. Do the homework and make a conscious decision on whatever choice you make. Make sure that you know both sides of it.
Hold up and be safe out there, man.
Be safe out there and wear a mask, man. At the end of the day. Peace, this is our take. Peace, y'all. All right.